Hello, and welcome back to the Wishing You Well podcast, where we help you navigate your wellness journey each and every week. I'm Amy Albero.
And I'm Catherine Van Eyck. We're both licensed therapists. And today, talking to you about acupuncture. We have a special guest, Dr. Andrea Orvieto. Andrea is on a mission to solve the tricky problems of fertility and women's health-related issues. With her doctorate of acupuncture and Chinese medicine, she has dedicated her career to improving the lives of countless women and men, empowering them to live the lives they dream of as mothers, as survivors, and as thrivers in her South Florida practice. Whether it's a woman with a lifelong struggle with PCOS, uterine fibroids, or endometriosis, a person plagued by headaches and hormonal dysfunction, a young girl with irregular periods, or a hopeful mother and father desperate to bear a child, Andrea sees all of her patients as a whole person or couple in need of healing. She does a lot, and we're going to talk to her about it. And this conversation is going to be amazing.
Yes, so excited.
Living full and well life is put together. Authentic.
We feel it.
Take care of ourselves.
So welcome, Andrea. We're so happy to have you here.
Thank you.
And we would just love if you could kind of go over and introduce yourself, tell our listeners who you are, a little bit about yourself.
Sure. Thank you so much for having me. I'm very excited. So I'm Dr. Andrea Orvieto. I'm a doctor of acupuncture and Chinese medicine, and I own a clinic here in South Florida in Hollandale Beach, Florida, near Aventura. And my practice is SOFLA Acupuncture and Wellness. And I I have been focusing on women's health and specifically fertility all the way through conception and postpartum and as well as perimenopause, menopausal and all of that. And I also treat pain and anxiety and sleep disorders as well. But I would say about 80% of my practice is fertility, whether it's men or women. And I absolutely love what I do. So, yeah.
Wow, amazing.
Yeah, you do it all. We're so excited to have you here today talking with us about one little portion of what you do, which is the fertility side of things. But I would, we talk about, as being people that are in helping professions, and that, of course, like us taking care of ourselves is so important. We're kind of our greatest tool that we use in our work with people. And so self-care is such a big part of what we do, what helps keeps us well. And so we love to check in each week, Catherine and I, and with our guests about self-care, what that looks like currently, what that looks like for you, and whether that's something maybe smaller, appetizer size, that's, drinking water, getting, some fresh air, something a little bit more hearty, like a main course, like I don't know, sometimes it's going to therapy or spending time with friends and family, or maybe sometimes it's a treat, like going somewhere special, getting a massage, things like that. Or sometimes it's kind of a full 3-course meal. You really need a lot. Maybe that's a trip or really blocking off time for yourself throughout a weekend or something like that. So, what does self-care look like for you in this season of life?
This season of life is pretty busy because I own my own clinic and I have a 6-month-old and I also have a almost 3-year-old. And so right now self-care looks a little bit different than it used to, but I still really try to have some type of a balance, understanding that it may not look like what I envisioned it as. So something that is important to me is making sure that this time around after having a baby is making sure that I have some home cooked meals. And because after my first son, we did a lot of frozen meals and I just didn't feel well. And so this time I really focused on that and having home cooked meals available. And also I block off some time. We do have part-time help at home. My older son is in school and my younger one stays home with a nanny when I'm at work, and I get my nails done because I think it's important because of my profession to have nails that look nice and also makes me feel good. Yesterday, I did get a massage. I'm currently breastfeeding. So postural wise, I'm slouched over while I'm breastfeeding. And so getting some type of body work, whether it's chiropractic care or a massage, is really important to me. And it may not be weekly, but I try to fit it in at least once a month. And I also, working out is a really huge part of my life. I've been an athlete my whole life, and working out is just kind of like breathing. And I finally got back into that, more of a consistent schedule. So a few things that, what that looks like for me.
A few, yeah, that's a lot. You're squeezing in a lot with everything that you do.
I try. I really try.
Yeah, it's so well-rounded too, which is great to hear. And I think with self-care, like self-care and self-awareness for us, like go so hand in hand. Like you had said, like, okay, I had this experience with my first child. This is what I learned. So this is how I'm going to be proactive with my next one. And so I think that's so much of what like self-care has looked like for me, for us, for many of our guests, has been like how to be adaptive and how to like apply like our learnings forward so that we can continue to take care of ourselves well.
Yeah, I think it's really important. And something to touch base on is before I had children, I created my hours at the office that I'm physically in the office treating patients as if I had children, because I knew when I did have children, I did want to be, because I own my own business, one of the perks is that I can make my own hours. And so I'm physically treating patients about 14 hours a week. And that gives me a balance of being both with my baby and also being able to be with my toddler and giving that. So that was really important to me as well. And so I think that starting that off when I opened, it allowed my patients to already get used to, this is what my schedule is, and not when I have a child, then I have to like either sacrifice something that I wasn't really willing to sacrifice, or change it and have really angry patients. Mm-hmm. And so there was that being proactive as well.
Mm-hmm. That's awesome.
Yeah.
I mean, that's a great way to look at obviously your life transition and how that was going to change and everything, but also like what was going to work for you, and your family and for you and your self-care, like we're talking about.
Yeah. So it was really important. And it's worked out very well because I'm able to fit in time for myself and time for my husband and for my children as a family. So, and that's very important. Even it's not alone self-care, it still fills my cup up in that way. Yeah.
Catherine, what about you? What is your self-care looking like these days?
Well, also speaking of being adaptive, so I think Andrea, I told you this. I'm pregnant.
I didn't know that.
I don't know if I said that, but I am.
Congratulations.
Thank you.
How far along?
On Saturday, I'll be 30 weeks.
Oh, okay. So you're really pregnant.
I'm really pregnant.
Wow. Congratulations. That's so exciting. Is this your first?
Yeah.
It's exciting.
It is.
And all of the things.
Yeah. Yeah. So speaking of being adaptive, and I know it's not nearly as hot as it is down where you are right now, up where I am, but it's hot, especially being pregnant. It's really hot. And
in the summer.
Yeah, it's summer. And so a huge part of my self-care is getting some daily walks in and getting myself outside. But to be honest, I really don't want to go outside, especially if it's super, super hot and it's the only time I can walk is the middle of the day, then I'm not going to do it. It's not happening. But I do have a walking pad that I brought up on this podcast before that I was using in the winter pretty heavily, because also not a great time to be outside. So I'm flipping that now and turning my AC on. I'm gonna hop on my walking pad later. And that is my self-care main course for the day, for sure. It's making sure I still get those steps in, even if they're inside.
Yeah, that's good. I know movement's so important to you.
Yeah. Yeah. Especially now. I mean, walking is so good, and getting these certain stretches in is so good for where I'm at. So gotta do it.
That's so exciting. I think that it's really important when you're pregnant to respect where you are in the pregnancy. And we have these ideas of like, when you're pregnant, I'm going to be working out, I'm going to go hard, I'm going to be one of those fit moms, like if that's what you do, and I'm not going to gain this weight. And then pregnancy, just like motherhood, it brings up things that you never anticipated. And one of the biggest things was surrendering and like letting go of the control and being okay with where I was and like where you are. And I speak to my patients in that way, and just really being present with that and not pushing yourself if you don't want to, you don't feel up to it. You're growing a human, and that's a really big task. There was a study done that they took, I think it was in the UK, that they compare, it was either in the UK or Australia, I don't remember, so don't quote me, but that they compared high endurance athletes with pregnant women. And high endurance athletes, their heart rate, I can't even remember right now, but peaked, at their highest performance for a short period of time. And then it would drop when they would recover. And they showed that women that are pregnant, it's sustained at that higher rate for the 9 months.
Wow.
So essentially, even though we may not feel it, or it may not look like it, we're performing at a very high level of performance because our bodies are working on overtime. And so it's a huge task that your body is doing. It's amazing.
It is amazing. And I think that I wasn't prepared for the mental challenge. I think that that's been the biggest thing for sure throughout the last 30 weeks is the mental game, the mental toll it takes on you.
Sure. Absolutely.
Well, how about you, Amy? How's your self-care?
Yeah, it's been pretty good. There's been a lot of like changes and transitions in the last, couple of weeks that for me, who tends to like love control, I've had to try to surrender in a different way and just kind of roll with whatever was coming. And so I feel like a little bit more even keeled, a little bit more balanced this week. And so I've been really trying to like lean into that and think about areas of like my overall well-being that I haven't been pouring that much into. And a huge piece of that for me is like my friendships, my social relationships, adult friendships are really hard to maintain and in general, but for me that can be one of the things that like takes a backseat to work and family and all of that stuff. And so I've just been leaning a lot more into my friendships this last week and like really trying to be a present friend, say yes to like going out, those kinds of things. And it really I'm more of an introvert. So like I always worry that when I go out, I'll feel so depleted after, but it never happens. Like I am so energized. It does so much for my like overall sense of wellness, like when I do lean into like my friendships and just laugh and all of that stuff. So that's what I've been really focused on this past week is like cultivating and growing and pouring into those relationships for self-care.
Amazing. I mean, I know that when you get really busy, I mean, when anybody gets busy, it can be so easy to just turn inward and just feel like the world's kind of closing in on me. I'm not going to make an effort to even alleviate some of these things, especially in a more social setting. So that's great that you are turning to those things that you know are filling you up in that way, even though it's kind of more of a challenge to do so.
Yeah. It's been good. And we hope that as the three of us have been checking in with self-care, that our listeners are also checking in with self-care, and that, being adaptable, being flexible is such a big piece of it. And self-care can change week to week. So continue to check in with your self-care. But Andrea, for you, with self-care, it's like, of course, one piece of well-being or wellness. And so we'd love to kind of learn from you, from your perspective, what living a well life or what wellness looks like for you in your life, what your view on that is.
Personally, or like with what I speak to
either
patients
way.
about, or all of the above?
All of the above.
That's a really great question, because we think of well-being and wellness as maybe what we look physically like, or weight, or how fit you are. And I think that as your life seasons change, that looks a little bit different. And I can personally say I feel my most well self when I'm active, and when I'm an extrovert, but I also feel that there's times that being an extrovert, you don't recognize when you need your battery to be recharged. So being able to say no to things that kind of opposite of you is like being able to say no to things because it's spreading yourself too thin. And I've been a little bit better at saying no to things, because I don't know whether it's because I'm a people pleaser. I had been a people pleaser. I just don't want to let people down. But recognizing that when I was saying yes to everything, my anxiety, and I don't find myself to be a very anxious person, my anxiety level would kind of, I would feel physical response of like, oh no, what does that look like? And so checking in with myself is, how am I saying no? Am I saying yes to the right things? Is my battery being recharged? With work, is delegating things, and I have an office manager at my office, and I'm slowly starting to expand and hire. So professionally, is being able to let go in the office so that I have more space and bandwidth for growing the business in other ways and being there for my patients. And so I think for me, personally, well-being is making sure that I'm checking in with myself, that I'm not just showing up to a workout because I feel that I have to, because it's part of my life and because it's what's expected. But that I really want to, and that this is what feels good for me, or going to a dinner, or whatever that looks like. So having that balance, both professionally and personally, is important to me. And I think that I've slowly learned how to say yes, no, when is appropriate for myself. So I think that question's really great. Mm-hmm. I really like that. I find that with my patient demographic, a lot of times, because the more difficult cases, patients that are dealing with infertility, they cut a lot of I don't want to say self-care, because I think that that's sometimes a privilege and a luxury that we don't always have access to, but more of that well-being. They're cutting a lot of things that help them be balanced. And so I try to help them at least take a little bit back of what makes them feel good and makes them feel a little bit back to themselves as well.
Mm-hmm. Beautiful and amazing that you incorporate that into your work. I mean, I guess you in a way have to, but in another sense, you're still targeting this other area of their life that isn't when they are stepping into your office. It's everything outside of that. That's important. There's a lot of things that can be taken away when somebody is struggling with fertility or holding on to pregnancies, and they cut out coffee, which to me is self-care, because I love the routine of coffee, having my coffee, whatever, the smell of coffee. They cut out working out. They cut out so many things because they think that if they do that, it's
going to be negative, and if they get, it's not going to be it's not good for them in the sense of getting pregnant. And so they lose a lot of like even small, minute things that may have used to make them happy. So you have to, it's part of the whole package.
I mean, you touched on a little bit about your work so far. Can you explain a little bit about how you got into this? Like why fertility is as like a main part of your work with acupuncture?
Sure. I wish that there was a huge elaborate story that I could share with you of why sometimes I find that the right people fall into the right path. And I just kind of rewinding back into my life, I got into acupuncture as a late teen in my early 20s because I used to get recurring urinary tract infections. And my acupuncturist was Chinese, like straight from China, barely spoke English. So to me, it was not even, I didn't even think I could get into it because I thought you had to be from China, very naive. And so I knew that part of acupuncture would be really great for and beneficial for women's health because it helped me with my urinary tract infections. So that's kind of like where it started. And then getting into it, when I first started practicing on my own, I was working at a physical therapist office, and I really enjoy helping people however way they need to be helped. And pain is a big one because there's a lot of people that are in pain, but I found myself not feeling fully fulfilled just treating pain, and not just pain because people in pain need help, but you know what I mean? That was my specialty. And so when I moved and transitioned to work out in my own office and facility, somebody had told me, like, don't get into fertility. It's too much pressure it's too much pressure for you because people want to get pregnant. And I get that. So at first I wasn't into fertility. And then I was recommended by somebody to come in to help them. And they were trying to get pregnant. And I helped them. And I was like, wow, this is something bigger. And I just fell into it. And I started taking a lot of continuing ed, specifically in the fertility world, pregnancy. I really became interested in it, learning about it, why, the ins, the outs, and all of that. And that's just kind of how my practice grew. And that's how I became where I am. And then I started working with patients that were going through IVF, IUI, and working with reproductive endocrinologists, and started linking myself up with OBs and reproductive endocrinologists, and gaining professional relationships with them, and really falling in love with helping people. Because listen, the lows in my office that can come along with treating fertility and recurring pregnancy loss is, lower than you would ever want to think about. But the highs are euphoric. And the fact that I can be part of that with patients to help guide them through and help be an advocate for them, it's worth every low. So there's no real not real reason. It just happened.
Wow.
Yeah. So.
And it's truly, truly such impactful and such meaningful work. I can totally relate to, or what you were saying about resonating. I was resonating with, like, the lows are really there and low, and the highs can be really high, but the honor, the privilege it is to be with someone through their journey is so humbling. It's so, I feel really grateful to be able to kind of do that work, even though it's really challenging. And yeah.
And I say to my patients, some of them don't get pregnant, or they stop their journey with me before they get pregnant. They need a break. And when that happens, I said, just thank you for allowing me to be part of this process, this journey, at least to this point. And I also find that on a different note is that there is not a lot of advocacy for for this. And now it's being spoken about a lot more. And now there are more advocates for infertility and fertility challenges. And so I want to be that. I am that advocate for my patients, because there's a lot of lingo and a lot of medical talk that most people don't truly understand. And so they're going into this journey, not anticipating having to go into this journey, and they don't know what to do. Mm-hmm. And so I really try to help and hold my patients' hands through that, whichever direction that leads them to.
You said that like people are like, this is being advocated more and more. Are you finding, or do you know if more and more people are struggling with fertility, or is it just being talked about more?
I think both. I think it is being spoken about a lot more. A lot more people want to share their stories so that they can connect, and if they can even connect with one person to show that they're not alone, that they feel like they did their job. Like, I struggled and I want to share so that you know that there's hope and you're not the only one out there. So I think that a lot of it is being spoken about more. We have social media now. There's 4 million different platforms that you can join. And so there's a lot of people on there. And so there's a lot of people that you can link up with and see their stories and follow their stories and all of that, which I don't think we really truly had access to, even though Instagram has been around a long time, and Facebook, but more and more the communities are growing. I think that's part of it. Yes, people are speaking about it a lot more. And in addition to that, I think that there are more people struggling with it for multiple reasons. I think that it's an environmental thing. There's a lot of pollutants and toxins in our environment that we've been around a lot longer. People are waiting a lot longer to have children, and not to say that you can't have a child in your 30s or 40s, but we don't even check our hormone levels. It's not part of standard care to check our hormone levels to see what our fertile health is early on. So if you're 20, 21, 22, like my mom was when she had her first child, that it just happens. And like, you're much younger in a sense of like that the likelihood of you getting pregnant is going to be higher. And there's a lot of talk about, growing up about abstaining, about avoiding getting pregnancy, rather the talk of what your fertile health is, what your hormones do, how to check. And yes, we can teach about how not to get pregnant, but I think that that's also an issue, because now we're waiting. If you graduate high school around 18, and people used to get pregnant shortly after, that's just a couple of years, but now we're waiting 10, 12 years, 15 years to have a child, and we just have an annual PAP. Mm-hmm. Right? Instead of having hormone levels pulled, and what does our ovarian reserve look like, and giving options. Is it important at that point for that patient to have to freeze their eggs, because maybe their hormone levels are looking maybe not ideal, but they're still at a point where they're young enough that their quality of their eggs are great, so they can freeze them at a younger age. And so I think that there's a twofold. There's multiple answers to that. Yeah. And so, yes, it's being spoken to. And yes, I think more people are having difficulty.
Mm-hmm. Well, and it seems like there's so much confusing information out there too, that, I mean, even with, I was thinking about getting pregnant last fall, and I had missed a period, and it had lined up with my OB annual appointment. And so I was like, am I pregnant? And I wasn't. And she said, like, if you're starting to try, continue to come back to me in a year. And I was like, a year? And that's pretty standard, no? It's
1 year if you're under 35, and it's 6 months really if you're over, or you're 35 or around there. And I think that I think that will change. Mm-hmm. I think that will change. medicine and Western medicine, like it just takes a long time to catch up.
Mhm.
But why a year? Like, find out now. There's so many. If everything looks great, amazing. But if there's a red flag of potential something going on, like why not catch it then so that we can do something about it and not wait a year.
Mhm.
And so I have patients that are trying to get pregnant that are anywhere from 25 years old to 43 years old, maybe a little bit older, but really in that age bracket. And even my 25-year-old, go get your hormone levels, because with that, we see the greater picture.
Mhm. Mhm.
There's more to, are you getting a period every month? And there's more to that.
Yeah.
So you're right.
Well, and it does seem, and maybe this is my own bias coming out, but like the culture of Western medicine is a little bit of like a wait to fail model. And that, like, again, delays so much. And it doesn't actually provide with enough information. And what you were saying about the amount of information that we are provided with in order to kind of prevent pregnancy, in proportion to like what we learn about, fertility or fertile health. I mean, that kind of blew my mind, just like the resources that are not getting directed toward the proactivity around just women's health in general. Yeah, it's wild to me.
It is wild. In my 6 years of practice, and let's say I'm 4.5 years of really focusing on fertility, I have had one patient, and I have a lot of patients, and I see couples as well. I have had one patient that when she came into my office, she said, when I was 23 or 25, before I met my now husband, I went and I had all my hormones checked and I froze my eggs because the doctor said that I may have difficulty getting pregnant because she had something going on at that moment, that I may have had difficulty. She still has frozen eggs. She got pregnant naturally. Unfortunately, she had a miscarriage, but then after that, she had 2 healthy pregnancies and 2 babies after that, and hasn't had to tap into her egg reserve. But one patient in my hundreds of patients that I've had that have worked with fertility.
Wow.
Yeah. And I'm sure that has something to do with her parents and like, hey, let's go. Well, I think her father's really big into like holistic and practices and all of that. So they did that.
Mm-hmm.
And I think that's brilliant.
Mm-hmm.
Not everybody has to go through freezing their eggs. It's expensive. It's physically taxing, but at least we have an idea of what's going on.
Mm-hmm. So if someone's listening to this now and knows at some point in their life they would like to get pregnant or have that option, and they want to maybe advocate for themselves a little bit more, like what should they ask for, or who
Sure.
should ask?
I think to start off is going to their OB
Mm-hmm.
and having their hormones checked. It's through blood. Mm-hmm. Their fertility hormone or reproductive hormones checked at that time. It's a simple test because that'll show us at least baseline of where you are right now. They'll find out what their AMH is, which is the anti-Mullerian hormone, which gives us an idea of reserve. And, I have a love-hate relationship because I think it's an important number, an important blood test to have, but a lot of people weight it very heavily, saying like, oh my gosh, I don't have enough, my reserve is low, so I can't get pregnant on my own. I'm going to have to do IVF. That's not the case. We understand like you're a big puzzle. That's just one piece. And so that's important. Your luteinizing hormone, which is your LH, right, it surges right before your ovulation. FSH, which is the follicular stimulating hormone, which is the hormone that's released to tell your ovaries like it's now time to ovulate, estradiol, very prolactin. Those are very basic tests that can be run at any time of your life, that you want them at a specific time of your cycles, so you know what that looks like. But it's easy. It's a blood test. It's not an invasive surgery. Mm-hmm. So it should be a standard of care, a standard practice, especially if whether you're on the fence of having children or you want to have children in your life.
Mm-hmm. Mm-hmm. Okay. It's just like so much information that people don't know about. What about misinformation? Like, what about what's out there that you've noticed that people are hearing that is just so off?
I think what's out there that is just so off. I think that there are people that have major platforms in social media that are not medical professionals, that are spewing information that essentially they're Googling or they have learned for them. And that is very different than a medical professional who, whether it's a Western medical professional or Eastern medical professional, that you have gone to school, taking courses, learned and studied and continue to learn and study. And so I think that is a huge downfall of social media at this point, because can get into the wrong hands of somebody. I mean, anybody can call themselves a fertility coach, but what are their credentials and what have they studied? And just like in any field, right? I think that it's important to understand your place in your lane and stay within that lane and find people that you can team up with to be able to refer out when it's not in your lane any longer. And so that it's a team effort with medical professionals and in that are well-versed in that field. And then if you need somebody that is, whether it's a medical professional, like a medical doctor, a reproductive endocrinologist, a therapist, acupuncturist, physical therapist, a nutritionist, dietitian, but make sure they're legit. And they're not just, because people can say, hey, I went through infertility, so I know, and now I'm going to be a fertility coach. Mm-hmm. And you can become a coach of anything, right? Like there's no licensing for it. And so I think that's like a huge issue with misinformation in multiple subjects, not just fertility, but fertility is so specialized. And it's so intricate. And if you get to somebody that is a quack, that can really screw up your potential, and it can really mess up, because we're talking hormones. We're not talking like a workout plan, not to put down workout, because I think it's important. It's very difficult, but like we're talking hormones, and we're talking trying to grow a baby in there. And so if you're getting to somebody that does not have a legitimate license and I wouldn't go to a surgeon, a gastrosurgeon to do my heart surgery. Like, So be careful where you get your information from. I mean, there's a lot of misinformation and confusion, but that's going to be a major issue.
Mm-hmm. Mm-hmm. Know your source, to check your source.
Know your source. Mm-hmm. And for people that are listening, understand that anybody that has a medical license, you can look them up and see if there's been any malpractice issues with them, what is going on. And I think that's important too, because there are people that will call themselves fertility specialists. Maybe they're gynecologists, because you don't have to be a board certified reproductive endocrinologist to like do fertility specialization, which is unfortunate. Listen, I love my OB, and with that, he respects the field, and he will refer out once he's like reached his limit of what he knows and what he can treat. But there are people that call themselves fertility specialists, and like, be careful where those sources are. So you can look up somebody's professional license as well. And I think that's important.
Yeah.
We haven't exactly dove into your work specifically and how acupuncture is even related to fertility. Can you talk about that? And
I'd love to.
Yeah.
So acupuncture, traditional Chinese medicine, has been around for thousands of years. And thousands of years ago, they did not have access to birth control. So with that being said, acupuncture in Chinese medicine is exceptional when it comes to women's health, because a lot of the times we have to get down to the root cause of things. Listen, I'm not against birth control. I think there is a time and a place for birth control. I used to be on birth control many, many, many years ago. But I think that when a teenager has irregular cycles or acne or bad periods, rather than just putting somebody on a pill, like, figure out why. Because birth control doesn't necessarily directly impact your fertile health, but it can mask problems. And if people are on birth control for 15, 20 years, and that's like starting from zero, you never knew you had a problem because you're on birth control. So acupuncture in general is exceptional in women's health, regulating women's, your menstrual cycles, relieving cramps and pains, working with endometriosis and PCOS, which is polycystic ovarian syndrome, and working with the reproductive system in general. And so I work alongside many medical professionals in the Western field, and I respect what they do. And there's a lot of stuff that I can't do as an acupuncturist, but acupuncture can help your body reset and function, in a more functional state and normal state. And I wouldn't say that acupuncture directly balances hormones, but it helps your body get to a place where it can regulate and have regular hormonal function with maybe supplements, Chinese herbs, different things, dietary wise as well. And acupuncture is really great with relaxing and tapping into the parasympathetic nervous system. And in our society, we're on that go, fight or flight all the time. And that's not conducive to hold a pregnancy. So acupuncture can help relax that. It also sends blood flow to the reproductive system, sends blood flow to the ovaries, which is really great for egg cell rejuvenation, and so which can impact egg quality, in addition to sending blood flow to the uterus to help thicken the uterine lining and to help with implantation and holding a pregnancy. I've worked with people that have fibroids, and we've worked together between dietary supplement and acupuncture to help shrink fibroids, because during pregnancy, if you have one, it can be potentially dangerous to the pregnancy, but also could be painful, and there's not much that you can do with that. So acupuncture, there's so many things. There's been studies that show that if you're doing any type of Western intervention, IUI, insemination, in vitro, IVF, or medicated cycles, it can help up to 65% of the success rates for that as well. So depending on what route you're going, acupuncture there's really no negative side effects of acupuncture and a negative impact of acupuncture with your fertility journey. So I always advocate for it, but if you're really in it, I always say do everything that you can. Number one, get yourself to without being fully stressed out. Also, be able to afford it and do all of it so that it can yield you the best results.
It's mind blowing.
I know. It's so compelling. Why wouldn't you?
Sure.
That's amazing. Wow.
Yeah, it's, and I think that's one of the things that as I continue to do it, couples that come in, it's also exceptional for male infertility, for sperm function, for motility, for the morphology of sperm, and it can help. And I always say, if there's going to be a fertility issue, unless the men have no sperm, treating male factor infertility is much simpler. women's reproductive systems are complex and intricate and wonderful because we're holding a pregnancy. But if it's a male factor thing, like that's something that can be addressed somewhat significantly easier. And so acupuncture helps with rejuvenating healthy new sperm with new cell growth, all of that as well.
Whoa.
Yeah. And so I think that's why, it's never boring. It's always challenging. Every couple comes in, some of them have similar issues, but there's not one person that's exactly the same as the other.
So if a couple comes in, do you end up treating both of them, or does it just depend on circumstances?
Both. I really, even if there's no male factor and fertility issue, I really encourage the couples coming in together, even if the female is coming in twice a week and their male partner is coming in once a week or once every other week. There's a lot of weight that falls on to us as females and holding pregnancies, that it just by the partner showing up is really helpful, because it takes two to tango, and it's the beginning of a wonderful, sometimes stressful, sometimes devastating, and sometimes really challenging, but wonderful journey. When you do have a child as well, it takes it takes a village. And I think now in our society, our partners are much more involved. Women are working as well. Women own businesses as well. And so I can tell you that we have in my house, is it 50-50 all the time? Probably not, because being the mother, a lot falls onto you, but I have a really wonderful partnership with my husband. And so just by them starting off and showing up to appointments, it speaks a lot. And I think that it's really helpful. And sometimes I treat just the female or just the male. But I really try to encourage couples coming in together to some extent.
I love that. I mean, it builds, as you're saying, like just the emotional support kind of built in through what can be and often is a really kind of stressful experience. So Catherine and I have actually never received acupuncture before, and I'm not sure if any of our listeners have, but like what can people expect from that experience, from a session? Does it hurt? Like, all of that stuff.
Tell us everything.
So acupuncture in general shouldn't hurt. Mm-hmm. The needles are super fine and flimsy and like hair thin and so some areas, some acupuncture points may hurt more than others just because of the area that they're located in. But I always say that it's really like as if you're plucking an eyebrow hair, just like the initial insertion. And sometimes patients don't even feel it. And they're like, oh, that was it. And sometimes my male patients are sweating. And I mean, females too, they get nervous too, but it's just funny how that happens. So it's very gentle. I treat pediatrics as well. So I always say, like, if I can put a needle in a 5-year-old, a 4-year-old, a 6 or 7-year-old, like, you can do it. But, I go gentle at pace because people do legitimately have a fear of needles, and I get that, but it's a completely different needle than, taking blood, getting a shot, any of that. So it's fairly gentle. One thing that it does is a lot of my patients that are trying to get pregnant, a lot of them tend to be type A, very stressed, very anxious, and it forces them to relax. The first session, they're like, what do I do? I'm not going to be able to relax. I said, try, just try. You don't have to fall asleep. You can listen to a podcast. You can meditate. You can, I have music going in the office. Do your best. I always give them a little button. If you need anything, press it, because their body needs time to relax. And so this kind of forces it. So a lot of my patients leave, they're very even, calm, a lot of them fall asleep for the 40-ish minutes that they're in there alone. So it's gentle and effective.
Wow. So it's about 40-ish minutes. So there's like the insertion, and then there's the kind of like just laying or sitting with the
Marinating.
Marinating. Love it. Okay. And is there like, and I imagine it's different for every person, but like, is there a number of sessions typically that people have, or does it really vary?
It greatly varies. It really greatly varies. And people, they'll call, and the first thing on the phone to set up an appointment, they're like, well, how much and how many sessions?
Yeah.
And my office manager is like, come in for a consultation. I need to hear what's going on before I can give you an idea of what we're looking at. I always say it's a minimum of 3 months. I see my patients twice a week, a minimum of 3 months. Most of the time they're hooked, and I see them through their entire pregnancy. It's not always twice a week. Acupuncture is wonderful in so many ways. And one of the downfalls, I don't even know that you would say it's a downfall, but because we're working with individual bodies, it's slower moving. It's not a medication that you're taking. So it takes time for your body to respond to it. So I have patients that get pregnant in 6 weeks. Wonderful. That's not the norm. And I have patients that get pregnant in 8 months to a year. It depends on what you're going through. It depends on what's going on. Do I have to regulate their cycle? Some people come in and they don't have their cycle, so we have to get them a cycle. There's so many different variants that impact what that looks like.
Makes so much sense, of course.
Right. I'm sure it's similar in your talk therapy. Like, you don't know what you're working with until you know. And it's really hard to see what that will end up like, and how quickly, are they doing the other work on their own? Right. Are things of that nature that can impact the results of what we're working with. So it's a hard thing. And people are like, well, why can't you tell me? I was like, I wish I could. Let's start here.
Right. Yeah, that's definitely our experience as well. And as you're saying, like, everyone is so individual and so unique. There is not one size fits all when it comes to any of it. But yeah, we can kind of come up with a starting point and then go from there. Yeah, that's all we can do. Yeah.
I said, I'm not tying you down here, and you don't have to be here forever. If you're unhappy, I want you to be happy. And another thing I say to my patients, I said, if getting to my office is stressing you out more than not, it's not the right thing for you. Especially when we're working with fertility.
Yeah. Right.
So, but it's varied. It's greatly varied.
Is there anything else that you want to add about your work to tell our listeners?
So a lot of just simple questions that I get a lot is acupuncture safe during pregnancy? It's absolutely safe during pregnancy. Here's the disclaimer. You want to work with a practitioner that that has experience with pregnancy, because there are points in our body that could move things a little bit more, especially in vulnerable times of pregnancy, that you don't want. So you want to make sure that you have a practitioner that's experienced in pregnancy, fertility, and all of that. So acupuncture is safe all throughout pregnancy, getting pregnant, even postpartum. You just need to make sure, just like in any field, that you're working with somebody that has that experience, that has the that specializes in that. You don't want to just go to a general one because they may take your insurance or because it's cheaper. And I know that it's a financial investment, but going to the right facility, whether it's me or someone else, it can be a game changer for your fertility journey. So I think that number one, it's very safe during pregnancy. It's very helpful during pregnancy, and it's important to go to somebody that is practiced in that specialization. Just as like if somebody were to come to me for something that I'm not familiar or comfortable treating, I'm not going to take them on. People come to me for weight loss. I was like, I'm not your girl.
Mhm.
And I don't do that. And so I'm so sorry, but that's not what I do. Or if somebody comes to me, they're diabetic, there are acupuncturists that focus on that, or eye disorders. That's not me.
Mhm.
And I'm happy to refer out. So just know where you're going.
Yeah. Well, can you also tell our listeners where they can find you?
Absolutely. So you can find me physically I'm in the Hollandale Beach, Aventura area in Florida. And online, you can find me on Instagram. I'm Dr. Andrea Acu and Wellness. I'm pretty present on there. I have somebody that helps me like edit and do that stuff, but it's me. If you're going through going into my DMs, that's me. And so I'm really active there mostly. I've tried TikTok. I'm too tired to do too many things. But mainly active on Instagram. You can find me on Facebook, the same, Sofla Acupuncture and Wellness. And I have my website is soflaacupunctureandwellness.com. And yeah, that's where you can find me.
And I will just plug in here that your Instagram is not only entertaining, but super educational. I love all the videos.
I'm glad. I'm so glad. I try. It's exhausting to keep up with social media. Holy moly.
Oh yeah.
It really is. Yeah. And we'll make sure to link all of that in our show description as well, and on our social media too.
All right, guys. Have a good one. It was a pleasure meeting you.
You too. Bye. Take care.
Bye.
Okay. What an episode. I feel like I learned so much, and there's so much more that I want to learn. So we'll definitely have Andrea back with us to talk about all things women's health and health in general. She clearly has so much knowledge and experience. So stay tuned for a follow-up episode with her. But we do want to thank you for listening and for following along, for all of those ratings and reviews. They really, really do help us get our message out there and get information out there, and also help us have an understanding of what you're liking and what you want more of on this podcast. We also appreciate the follows on Spotify and Apple Podcasts. Make sure you're also following us on our YouTube channel, Revive Center for Wellness, where you can see full episodes of this podcast, as well as our bonus weekly podcast, Reactivity TV, where we're giving our therapist takes to all of the trending shows and movies that you are watching. Go check that out. Also follow us on Instagram and Threads at Revive CFW. You can follow Catherine at Catherine Van Eyck, me at Amy Albero LCSW. Check out our website, revivecfw.com, and send us your emails to wishingyouwell@revivecfw.com. Until next time, we are wishing you well.